Hi, my name is Kendra Julian, and I am the Adolescent Immunization Specialist at the Partnership for Maternal and Child Health. And today we're going to give a brief discussion about the importance of flu and the vaccine. I have here today with me Jennifer Smith, and she'll be, providing some information regarding flu. So, Jennifer, just kind of just let us know who you are, where you're from, and introduce yourself a little bit.
Sure. Welcome, everyone. My name is Jennifer Smith. I am a health educator for the New Jersey Department of Health Vaccine Preventable Disease Program. In that role, I am involved in creating material, working with our internal and external partners to provide vaccine education. And personally, I've been a Jersey girl my whole life, born and raised, and I'm happy to be here today.
That's great. Well, thank you so much for taking part in this live. So, we could just jump into it. So just some questions for you. We know that this is you're in flu season. People often have a lot of questions about flu, why this vaccine is important, but also most importantly, we're also in a pandemic. And again, the hesitancy around getting vaccinated. But I just want you to give us a little overview of what flu is, why it's important, and who should get vaccinated.
Okay. Well, flu is a contagious respiratory illness. It occurs, usually begins like around in the fall, can extend as late as like May sometimes. It's easily spread. As I said, it's very contagious. Some folks will be fortunate and will have a mild illness. So you still have to worry about days missed from school or work, or other activities. And then for some, flu can be very serious,
Hmm.
especially if you have a chronic health condition. So if you have, asthma, for instance, and you get sick with the flu, it can make your asthma worse or make it even more difficult to breathe. Um, and again, this year, every year we recommend a yearly flu vaccine,
Okay.
but this year is especially important because we are in a pandemic.
Mhm.
Um, and although getting a flu vaccine, this is something I want to point out, getting a flu vaccine will not protect against COVID-19, but the flu vaccine can help to reduce flu illnesses and hospitalizations. And this is really crucial because this can help to conserve our potentially scarce healthcare resources that
Okay.
are much needed during this pandemic. So preventing flu means fewer people will need to seek medical care and testing for possible COVID-19 or flu. So it's really important that we take all the necessary steps we can.
But that's really good information and good feedback. And again, like sometimes you often hear this question. Well, how effective is this flu vaccine? Is it safe? I mean, you made a good point. You said that it's best that we get vaccinated for flu every year because I've also heard people say, "Oh, I got vaccinated for flu last year. Do I need to get vaccinated again?" So, but go ahead.
Yeah. That is a common question. And the reason why it is every year is because flu viruses change.
Mhm.
And so it takes a while for the World Health Organization to work with their partners to identify the most common strains that will be circulating.
Okay.
And even if the vaccine, because sometimes in the past we saw that the same strains from the previous year would be the same strains in the current year,
Mhm.
but it's still, even when the strains are similar, the it's still important to get a yearly flu vaccine because protection wanes or decreases over time. So that's why you want to make sure that you have the most current flu vaccines, that you have, the most protection possible. And also the vaccine, there are many different, viruses that circulate, but depending on the brand of vaccine that you receive, the flu vaccine will protect against three or four of the most commonly circulating strains.
Okay, good. That's good. That's good to know. And so, um, how safe is getting the flu vaccine?
Well, the flu vaccine is very safe. I mean, that's a common question, and hundreds of millions of Americans have safely received the vaccine over the past 50 years. And there's extensive research that, supporting the safety of flu vaccines. Most common side effects are really related to, like, as soon after getting the vaccine, like the soreness at the injection site, redness, or maybe some tenderness. Some people may have, other mild effects, like they may have a slight headache or muscle aches, and that's really just showing you that the vaccine's working. It's doing its job. It's activating your immune system.
Okay.
But the CDC, which is the Centers for Disease Control and Prevention, and its partners, they use multiple systems to monitor the safety of flu vaccines. So it is a safe vaccine. I mean, nothing's 100%. Nothing in life is 100%. You look at it,
Right.
over-the-counter medication, you'll see, there could be side effects. But
Right.
in general, the benefits of the flu vaccine greatly outweigh any of the risks.
Got it. And what would you say, how long does it take for the flu vaccine to create the antibodies once somebody gets vaccinated?
It takes generally about 2 weeks.
Okay.
So that's why we really recommend, and I say the CDC and the New Jersey Department of Health, we really recommend that people, get their flu vaccine as early on in the season, but ideally before the end of October.
Okay.
They like to use the phrase "be seen by Halloween," before the viruses start to circulate in your community. But I know we're past October now. But it's still beneficial to get your flu vaccine now. In fact, next week, starting December 6th, will be National Influenza Vaccination Week. That's
Okay.
called NIVW. And the whole goal around this national event is to remind folks that flu viruses are circulating. And if you didn't get your vaccine yet, do so now. Be ready, in preparation for the holiday season. Because again, flu viruses can circulate, as late as April or May even. And with the current pandemic, of course, we want to reduce as much illnesses as possible and to protect ourselves and those around us who may be more vulnerable.
Okay. That's good to know. I often hear people say, I'm not getting vaccinated for the flu. I've got vaccinated before and I got extremely sick. And then they say, this flu vaccine, it gives me the flu. Is that true?
Yeah, that's a common misconception. The reason is because, first of all, the flu vaccine cannot give you the flu. The flu vaccine is created from, it's not like it's like the live vaccine is inactivated. So it's not able to produce the flu, like to get you sick with the flu. So the flu virus cannot give you the flu because of how it's made. It's a weakened form, or just a part of the flu virus itself. So it can't give you the flu. But what happens is a few things could happen. Perhaps a person gets sick around the same time or was exposed to flu viruses before they got the vaccine. So they may think that, oh, the flu vaccine gave me the flu, whereas they could have already been infected with the flu before they had the opportunity to get the vaccine. So that could be one thing that happened. Or also sometimes the flu virus, in order to activate our immune system, as I was saying earlier, some people have mild side effects, like they may get a headache or they may get muscle aches. And that's really just a sign that the flu vaccine is doing its job with our body. Our body's recognizing the virus and building up immunity or protection from it in case we ever come across anybody, in case we ever become exposed. So sometimes people mistake that for being sick with the flu.
Got it.
Yeah.
Got it. That's really good. And that's like the most common question, or people often say, "Oh, the flu gives. I'm not ever taking the flu vaccine ever again." So.
Exactly, exactly. Yes, they're made the vaccines that are given with a needle, they're made with either inactivated or killed virus or just like a single protein from the flu virus that's attenuated or weakened so that it can't cause that.
Okay. And how would you address, I mentioned this earlier, a vaccine hesitancy, especially for those, from certain cultures, living in certain communities based off the misinformation that they hear, or, people, we use a lot of Google and there's, pretty bad information out there. How would you address vaccine hesitancy, especially again, as I mentioned, we are in a pandemic, they're getting ready to roll out a new vaccine soon, and we realize how important this vaccine is, right?
Yeah.
How do you address vaccine hesitancy?
Well, I think vaccine hesitancy is really a spectrum. You have those folks who accept all vaccines, then you have folks who refuse all vaccines, and then for the vast majority of the folks are in the middle, which are just, regular people just questioning. They may not be against vaccines, they just have questions or concerns, which is quite common. And I think just taking the time to, provide education to folks and letting them know and addressing their concerns. People want to know that they're being heard and listening to those concerns. And I think offering credible resources, like you mentioned, there's so much information available on the web, but not all of it is accurate or trustworthy. So I encourage folks to really evaluate the information that they're looking at. Look at the information. Who are the sources? Is it sponsored by somebody? Is there any bias there? What are the credentials of the person who is posting this information? That's why I try to direct folks to the Centers for Disease Control or the CDC website. There are medical experts, your health department, the New Jersey Department of Health website. You really need to have that credible source of information and really speak with your doctor. Don't be afraid. If you have questions or concerns, of course, share them. That's normal. It's common to have questions. Your own health. But I encourage you to speak with your healthcare provider, and he or she can help to address your concerns. Let you know where credible information exists. So I think that's really the bottom line, is just knowing where to go to get your information and just looking at it with a critical eye when you do come across information to see if it can be trusted.
Yeah, I definitely agree with that response as far as advocating for yourself. And, when you have those questions and concerns, rather than, leaving your provider office, let them know how you feel, especially, with this in regards to vaccines. I often tell when I'm educating the community, I often say that all the time, whether it may be them getting vaccinated for themselves or if they're getting their babies vaccinated. You often hear about that, the multiple vaccines that a baby can get, once they're born. So that's really, really great feedback. Something else I wanted to ask. So, being that we're providing this information, and say there's someone who's really interested in getting vaccinated for the flu, where would you say they can go and get vaccinated? And how would you address those who don't have insurance? Is there some type of program that can help them, even if they can't afford to pay for the vaccine?
Sure. So there is a federal state operated program called the New Jersey Vaccines for Children program. And this is a program that healthcare providers enroll in. The program offers free vaccines to healthcare providers so that they can provide those vaccines to those who qualify. And those who qualify are those who are 0 through 18 years of age, who don't have insurance or has insurance that does not cover vaccines, those who are on Medicaid, and the program, it provides ACIP, or the Advisory Committee on Immunization Practices, recommended vaccines to these folks where otherwise, money would be an issue. We want to try to eliminate that barrier of affordability. So that's where the Vaccines for Children program comes in. So you can
Okay.
always ask your healthcare provider if he or she participates in the VFC program. Also,
Mhm.
a lot of health insurance. Um, you know, check with your healthcare provider to see, where they can access vaccine if you're having trouble locating it. You can
Okay.
also check out your local health department
Mm.
for if they have any upcoming flu clinics and if any of them are, low cost or if any of them are a nominal fee. Your federally qualified healthcare centers are another great resource because they often work on a sliding scale fee based on, the amount of, money you have available for vaccine and other services. And also there's a website called Vaccine Finder. I think it's vaccinefinder.org, if I'm
Okay.
not mistaken. I don't think I have it in front of me right now. Um, but that is where you can find some like local pharmacies as well.
Okay.
In case you don't get to go to the doctor's office, you can always step in and check with your local pharmacy as well. But there are resources available. I hope that answers your question.
Oh, no, absolutely. And for those who, thank you so much. That was really good. Who want to find those resources, what websites would you know, encourage them to go other than the CDC?
Okay, well, the Department of Health, and I'm going to read our website because it's a very user friendly. It's nj.gov/health
Okay.
slash fight the flu NJ, all one word. So that's, https:// nj.gov/health/ all one word, fight the flu NJ. I don't know if we can provide that on the screen or.
Great. Thank you.
So that's our main hub of our website. That's where all our materials are located. We have materials for healthcare providers. We have materials for the general public. And we also have the vaccine finder located on that website as well. And we also have the Power to Protect New Jersey toolkit, which is a campaign that the Partnership for Maternal and Child Health of Northern New Jersey um, is conducting a statewide flu campaign promoting the Power to Protect New Jersey, that we can all do our part by getting the flu vaccine to protect ourselves and our loved ones and our community members. So I encourage you to check out those resources as well. So I would actually start there. I think it would be a great starting point.
Okay. Well, that's good. Well, thank you so much for this information. I mean,
Mhm.
just as much as it's helped me, I'm pretty sure it's gonna, this information will be valuable to so many people. I mean, and outside of just, also getting vaccinated, we still want to make sure that we follow, hygiene protocols such as washing your hands and
Absolutely.
sanitizing and, you
Ab-
know,
Absolutely. You took the
yeah,
words
go ahead.
out of my mouth. Actually, if I were to leave you with any key points today, it would be
Mhm.
that, the flu is preventable. That's the key thing, that you do have the power to protect yourself and others through vaccination. I mean, maybe you think, oh, I'm generally healthy. I never get sick with the flu. But, think about others around you. Maybe you live with a person who suffers from a chronic health condition like diabetes or heart
Yeah.
disease, or maybe um, you're around somebody who is pregnant, or young children. Okay, we know young children are great spreaders because they don't always, they may sometimes forget to cover their coughs and sneezes, which can cause easily disease, make it easily spread. And you have to
Mhm.
get the flu vaccine. You have to keep in mind that not everybody is able to get the flu vaccine. Some people may have a medical condition, maybe they're
Yeah.
allergic to a component of the vaccine,
Mhm.
um, so they can't receive it, or maybe there's religious reasons why they can't receive it.
Yeah.
So by us getting the vaccines, we're helping to protect those who can't get it themselves.
Right.
Um, and it's also important, again, it's important to get the flu vaccine this year because, again, we want to potentially, help conserve those potentially scarce resources. Hospitals, clinics, emergency rooms, they're all going to, they're all handling a lot right now, our healthcare heroes. They have a lot on their plates, and whatever we can do to, help protect ourselves and others is going to make an impact. And like you said, there's other things that we should be practicing: healthy behaviors, covering your coughs and sneezes.
Mhm.
Don't cough or sneeze into your hands, because then you could touch other things and
Yeah.
contaminate surfaces. But cough or sneeze into your sleeve
Mhm.
as such. Wash your hands frequently. Stay home if you're sick. Except to get medical care, of course. Remember to wear your mask out in public. Practice social distancing. These
Mhm.
measures are not only helping us with COVID,
Yep.
but with other, illnesses as well. And I recommend, in addition to flu vaccine, make sure you're up to date on all age appropriate vaccines. Vaccines are recommended throughout the lifespan.
Yeah.
So check with your doctor. Make sure you're up to date because we want to do all that we can to protect ourselves.
Yep. Absolutely. Well, thank you again, Jennifer. I really
Thank
appreciate that.
you.
Really great live.
Thank
You
you for having me on a
no
lovely Friday.
no problem. Thank you so much. The information is so needed, especially at this time. And I really hope that people see the benefits and how important it is to get vaccinated. So thank you again. I really appreciate you going live with me and addressing
Thank you.
these concerns that we often hear about um, around this time of the year. So thank you again.
And be sure to check out the National Influenza Vaccination Week. You
Yes.
can see information about that on the CDC website. You can Google NIVW. Be sure to check out the department's website, nj.gov/health/fight the flu NJ, all one word, and the partnership's Power to Protect New Jersey campaign. And I wish you all safe and health during this time.
Yes. Thank you again, everyone.
Take care.
Take care.